Health Learning Network for this academic year. My name is Manisha Kulkarni. I'm an associate professor in the School of Epidemiology and Public Health at the University of Ottawa and the interim director for our Faculty of Medicine Global Health program. Our Global Health Learning Network is a monthly webinar series, which is a collaborative effort between the University of Ottawa School of Epidemiology and Public Health, the Briere Research Institute, the WHO Collaborating Center for Knowledge Translation and Health Technology Assessment and Health Equity, and the Global Health Program at the International and Global Health Office. And we welcome participation from across Canada and internationally from researchers, practitioners, learners, and members of the public with an interest in global health issues. And although participants are joining today from different areas of the world, as we are hosting this webinar from Ottawa, we pay respect to the Algonquin people, who are the traditional guardians of our land. We acknowledge their long-standing relationship with this territory, which remains unceded. We pay respect to all Indigenous people in this region from all nations across Canada who call Ottawa home. We acknowledge the traditional knowledge keepers, both young and old, and we honor their courageous leaders, past, present, and future. I'll start today by introducing our speaker, who will be presenting on the topic of decolonizing global health. What does it mean for academic institutions? Following this, the question and answer period will be moderated by Dr. Alice Werling, an assistant professor in our School of Epidemiology and Public Health and a global health champion. So please keep your microphones on mute during the talk, and feel free to put any questions into the chat, and we'll be able to get to these during the question and answer. So without further ado, I'd like to introduce our speaker, Laura Mkumba, who's a native of Dar es Salaam, Tanzania, by way of Atlanta, Georgia. She received her Bachelor of Science in Biology and Master's in Global Health degrees from Duke University. And Laura co-founded the Duke Decolonizing Global Health Working Group in 2018 to create a space for students, faculty, and researchers to critically reflect on the legacies of colonialism embedded in the field of global health. She spent the last decade working in international and domestic HIV/AIDS research initiatives with other research interests in mental health, health equity, adolescent health, and sexual and reproductive health of sexual and gender minorities. Laura currently works as a clinical research professional at Duke University, and we are very excited to have Laura here today to speak with us. Welcome, Laura, and over to you for your presentation.
Thank you so much, Manisha, and thank you once again for having me today, and thank you for that wonderful introduction. So I will go ahead and share my screen, and we can go ahead and get started. So I hope everyone can see this. If not, please just put it in the chat or just unmute and let me know.
Yeah, looks good.
Excellent, thank you. So as Manisha mentioned, today I will be giving a talk on decolonizing global health and what does this mean for academic institutions. So I'm going to begin the presentation the way I like to begin all my presentations or any talk, with a positionality statement. And positionality is just the social and political way with which I move through the world and really with which I move through this space. So my positionality in this current space is that I am a Black African immigrant woman, and I'm having this conversation in a predominantly white settler colonialist space. And I recognize the privilege that I have through my cisgender identity and level of education. And I also recognize that the words that I'm speaking today are a result of the work of queer, Black, Indigenous, and scholars of color who came before me and who also work, along in these conversations globally. And I like to always make a note that while I have this positionality statement, to be clear that my positionality will change depending on what space that I'm in. So currently, like I said, we're in a settler colonialist space. I am based in Durham, North Carolina in the United States. And this is a current position with which I'm moving through the space right now. And I also recognize that my positionality in this space does impact what I interact with and also how I communicate to the world. So I ask that you keep this in mind as I'm giving this presentation today. Next, I would also like to go over some key terms and definitions that I'm speaking. And also another disclaimer, these are the definitions that I currently work with as of 11:55 a.m. when I was finalizing this presentation. So just note that while I might give a definition today or for a certain term, these definitions could change, and you could ask me whether it's right after this presentation or even tomorrow or in a year, and my definition might change as, again, the positionality changes, or as I learn more and I engage more with text and communicating with others. But the first term I really want us to talk about is imperialism, which for me, I define it as the policy or practice of extending a country's power and influence through direct territorial control or military power. And the next definition I want to talk about is colonialism, which I define as the practice of domination and subjugation of one people to another through a transfer of a settler population to a new territory and the erasure of the indigenous people's knowledge, culture, religion, and language. So the reason why I made a point to highlight these differences is, one, I think these terms are often used interchangeably, and honestly, there really isn't a consensus of which definition works for which term. But personally, I like to make a distinction between imperialism and colonialism, in that I think of imperialism as kind of the thought or the mentality behind colonialism, and that colonialism really takes that step further in this ongoing erasure of this indigenous people's knowledge, culture, religion, and language. And I use the term indigenous to refer, again, we're in a settler colonialist space here in the US or in Canada, and so that means different things. However, indigenous people I also am considered indigenous because I was born in Tanzania in East Africa. And so I use that term to really mean, in the context of colonialism, when you're having this new group come, the people that were there before and that were indigenous to that land, they're the people that are going to be erased, whether they themselves through their population or their knowledge and their culture and their religion can also be erased through this violent practice of colonialism. The next terms I want to talk about first is starting with decolonization. So knowing that colonialism is this violent practice, right? The process of decolonizing or decolonization is this process of dismantling the legacies of colonialism and the repatriation of indigenous land, culture, knowledge, and language. So we are removing these legacies of colonialism, these systems, and we're also honoring and respecting that land needs to go back, that we need to honor the culture. We need to give sovereignty back to indigenous people who had their, again, their land and their knowledge and their language and really their identity stolen as a result of colonialism. And decolonizing global health is basically doing this process, but we're undoing these systems of colonialism that are governing the global public health agenda and that are controlling these levers of power that lead to global health inequities. And so those are the terms that I work with. And just so we're clear, when I'm using these terms throughout today's presentation, these are the definitions that I'm working with. Next, I want us to really talk about, so now that we've talked about what I mean when I say decolonization, I want to be clear with saying what decolonization is not a metaphor for. And this is a call to Tuck and Yang, who published a paper about that decolonization is not a metaphor. I highly recommend that anyone who's, whether you're starting out in these conversations or you've been having this conversation or following the decolonization movement for a while, if you haven't had a chance to read Tuck and Yang, I highly recommend it. I will share my slides at the end, afterwards, and I will include a list of resources that I think are really helpful for people to read. But first, when I talk about decolonization, I'm not using it as a metaphor for, first of all, reform. Just so we're clear, I think sometimes reform does have a place, not to say that I'm discounting reform, but when I say decolonization, I'm not using it as a reform or a metaphor for reform. Because personally, when I think of reform, I literally think of it as reform. I think of it as just redesigning or having cosmetic changes to the current systems and just making them more palatable. And that's not what I mean by decolonization. I don't mean reforming it so that we feel nicer about what the systems we're engaging in. I don't mean reforming it so that we don't feel as bad or that we feel that we're doing our part. I really mean this radical change and really mean dismantling. Next, decolonization is not a metaphor for diversity, equity, and inclusion. Again, diversity, equity, and inclusion has its place, and it's absolutely very important for institutions to work towards that. It's important for them to take these initiatives, but I don't consider diversity, equity, and inclusion as the only step to decolonize. If anything, that's really not decolonizing, because really with that, a lot of times people think that means it means more representation. And it's also to say that I don't use decolonization as a metaphor for more representation. And I put that in quotes to say, like I said, diversity, equity, inclusion are absolutely incredibly important. We need to work to diversify the institutions we work in. We need to make sure that people have equitable experiences and equitable access. We need to make sure that everyone feels included. But it's not enough to just have me as a representative, as a token. In fact, I don't want to be invited to these spaces as a token. I want to be included. It also means changing the system so that it's not, we don't work where I can only access this institution or access this space through an invitation of those who are in power. Because really that's working with colonialist systems. Decolonizing says that I don't need to have an invitation. I already have access to those places. I don't need to have someone extend a welcome to me. I don't need them to create a space for me at the table. It means that there is no table. So like I said, I don't use decolonization as those metaphors. And the last thing is I don't use it as a metaphor of fixing a broken system. And I put broken in quotes because I think the key thing with recognizing, particularly as we're talking about global health institutions and academic institutions, is recognizing that because they were built off of colonialism, because they were founded off this legacy of these oppressive systems, they're not necessarily broken in that they're often functioning the way they're meant to function because they were formed with these ideals in mind. And I'll go on further in a little bit to talk about what I mean by that. But for me, I will never say that we're fixing a broken system, because I recognize that really the system works exactly the way it's meant to, because going back to that definition of colonialism, it is about the erasure of Indigenous people. It is about the subjugation of Black and brown bodies. It is about the oppression of women. It is absolutely about the oppression of people who are poor. That is meant, the system is working exactly the way it's meant to, because that's how it was designed. It was designed to keep those in power, to maintain that power. And so when I say decolonizing, I'm not saying I'm fixing a broken system, I'm saying that I'm breaking it. And forgive me, I can't remember who exactly said this, but I saw this on Twitter once, where they said that replace decolonize with destroy. And if that makes you uncomfortable, then you're not talking about decolonizing. And that was so powerful to me. And I realized that's exactly how I really feel about it, is that if we're not comfortable replacing decolonize with destroy or dismantle, then that we're not talking about decolonizing, because again, we're going back to this reformation and this redesigning of the system to make it more palatable, but really about this radical transformation so that we have a more just system and everyone has access to health equity and health justice and living as people who are deserving of sovereignty and their life. So this is, again, when I'm going, as we're talking about decolonizing, I'm not using it as a metaphor or a simile for any of these terms here. And this is probably not needed, but I'll just like to give a context of the history of global health. I think most people recognize that global health as we know it today is a newest iteration of what was once tropical medicine, international health. And the reason I just put this figure here is just to really, again, highlight what I mean by saying that global health in today, the way that we're recognizing that there's something wrong with global health, it's also part of it is recognizing that it's functioning the way it was meant to. Because tropical medicine and international health, its predecessors, were created to protect the supremacy of white knowledge or Western knowledge. They were created to protect settlers who were in this colonial colonies, to protect them and, protect their health. Tropical medicine was really because you're having these settlers going into these colonies, encountering pathogens or, diseases that they've never encountered before. And so really was formed to protect them while they were there, because colonialism functioned in the, again, extraction of resources, extraction of people, extraction and erasure of knowledge. And so a lot of these systems were created to maintain that power and dominance and that subjugation. And so because global health had this smooth transition from being international health without really addressing its roots in that, a lot of, again, global health is going to be functioning in that same way. And we see that in the way that funding works. We see that in that funding is coming from, Western, and even actually the term Western is very colonialist. Really what I mean is predominantly white countries, that they're the ones who decide who gets the money, who gets the funding. They get the ones who decide what is the research agenda. They're the ones who decide, when you're talking about even the World Health Organization or these top global health institutions, you're looking at it and it's the representation there or the leadership is made up from people from high income countries. And even Global Health 50/50 did a report in 2020 that was showing really even within high income countries, you're really seeing white men in these leadership positions. So there's still a lot of inequality and inequities and who is in power and who gets to make these decisions. And so that's something that a lot of us are reckoning with global health today and seeing that there is this imbalance, and we're perpetuating this in our practice and in our research, whether it's working with our collaborators and seeing that, our collaborators who are either in low and middle income countries or former colonized communities, that they don't get to have first or second authorship or senior authorship, that they're always stuck in the middle, that they are, considered consultants versus, again, having the sovereignty to really decide how the research is done, that they are not getting to decide how the knowledge is being disseminated from this research, or they're not getting to decide what policies are implemented and what they're being created. And so that, again, I want to frame this in this historical context and saying, again, going back to the previous slide, that I'm not fixing a broken system. I'm not calling for fixing a broken system, but recognizing that it's functioning exactly the way it's meant to because of where it came from, because of its foundations. And so again, just like decolonizing, and I say it's dismantling that, I'm not talking about a renovation where I'm fixing the house, right? And I'm getting nice cabinets and wonderful marble countertops and wonderful hardwood, but then my foundation is messed up. What is the point of that, right? It's doing that actual change and that radical change of what this system should be and really tearing the system down. And so going from there, a question that I had while I was preparing for this talk is, is it possible to decolonize global health institutions, right? So what does it mean for academic institutions or global health institutions? And actually, Leoba Hirsch, who is faculty at the London School of Tropical Hygiene and Medicine, published a paper in January of this year with the same title, that same question: is it possible to decolonize global health institutions? And so I'm a firm believer in not redoing something that's been done so well. So I really want to take a moment for us to read a quote from this paper. And again, this is one thing that I also encourage everyone to read, because she goes really well and talks about what does that really mean? Is it really possible to decolonize global health institutions? And so I want us to read this quote from this paper. And, she writes, the institutions that have been built on and benefited from the racist exploitation of Black, Brown, and Indigenous populations the world over cannot decolonize and keep their epistemic, political, and financial power. If global health institutions are serious about their commitment to working against the legacies of colonialism and fighting racism, then they will need to give up some or all of their power. That means a radical redistribution of funding away from high-income countries, a loss of epistemic and political authority, and a limitation to our power to intervene in low and middle-income countries. That is unlikely to happen. Systems and institutions protect people, especially white people, all the time. So going back to this question, right, of is it possible to decolonize global health institutions? And so my answer is, it's yes and no. So starting with the no, and going back to what Leoba was mentioning, that last line of systems will always protect, right, institutions, and will always protect people who have that power. And so we cannot decolonize if we're expecting to still maintain the power that we have. So academic institutions cannot expect to decolonize if they still intend to maintain the same level of power that they have right now. And that is a very uncomfortable thought to have, because we are taught to think of, well, this is all we've known, right? And for many of us, while we may not, actively work towards the oppression of others, we unfortunately work in a system that does perpetuate that oppression. And so it is really uncomfortable for us to, one, recognize that we're working in this system that perpetuates oppression and colonialism, but then also recognizing that to really make that change, to really decolonize, that we need to have a very fundamental and radical change. And so that's very uncomfortable because we don't know what that looks like. And I say, again, I say that it's no, because a lot of times when I hear, as much as I'm happy to hear that more people are engaging in the decolonizing movement and are engaging in these conversations, I think a lot of that conversation has been focused on surface level change. And no one really wants to dig deep and think about what that really means for these institutions and the individuals that work in them. And I also want to be clear that I'm calling myself out in this, right? I currently work at Duke. Duke has a very rough history, to put it in nicer terms. And Duke itself, I think we can all pinpoint, even in the last year, instances where Duke has, the institution or individuals within Duke have acted in a way that does not mirror what we plan to, or mirror our purpose in working in global health or working in health equity, or to say that it promotes health justice or promotes racial justice or racial equity. Okay, I'm not saying that, again, I'm talking about that's my institution. Views are my own, just so we're clear. But I'm saying that because it's built off of this system, and so we're going to perpetuate it. It's built off this oppression, and it's going to perpetuate it. And so what would that mean to decolonize Duke University? As Leoba said, that could mean that we either give away some or all of our power. I think all. I think that could mean for some institutions that they no longer exist. Again, that's a very uncomfortable thought to have. That's not something that we all want to hear, right? But that's the true reality of what decolonizing. Again, going back to that, we need to be able to replace decolonize with dismantle or destroy. Otherwise, then we're not talking about decolonizing. And so that's, again, that no is systems are built to protect each other. Something this morning that I thought about was as I was checking Twitter, I saw that a popular Nigerian artist crowdfunded to get money for his Rolls Royce. Now, this artist is worth, I believe, millions of dollars, but you had people who actually donated to help him get this luxury car. And then right underneath that tweet of someone talking about that, I see a tweet of someone, for mutual aid where someone has a GoFundMe because this is a non-binary Black person who needs to escape their home because they're living in a toxic situation. And so when I see those two things and I see that juxtaposition, again, it's not related to global health, but really makes me think of this idea of systems are meant to protect each other. And so, for example, Leoba mentioned that we need to redistribute financing and funding. And part of the decolonizing, not just of academic institutions, but within institutions that we work in, and also with our world, is this redistribution of wealth and power. And how can we do that when you have someone with plenty of wealth, right? They're very talented, but they have plenty of wealth, and they still can benefit from a system where they can amass more wealth. And you have someone else who is already marginalized for who they are, for their gender identity, marginalized for their race, and they need to escape their home. And they are struggling to get even $400 raised in order to escape their home. But you have this millionaire who's able to raise over $100,000 to get a Rolls Royce, which in my opinion is completely unneeded. And so that is, I think, what Leoba really was talking about, and what I really think about in saying that systems protect each other, and that even some of the people that donated were wealthy individuals. They can think about redistributing wealth when it's amongst themselves, but you don't want to think about redistributing wealth when it's really considering somebody else who needs it. And so when we keep working with that mentality, I do not think it's possible to decolonize, whether it's our world, whether it's our communities, and whether it's institutions. And so if we keep thinking about still holding on to our power, still holding on to our wealth, still holding on to our own prestige and privilege, while saying that we want to work to decolonize, then it's not going to be possible. But then I also say, yes, it is possible, because if we all work collectively, if we all first start with that individual reflection of what does that mean for me to give up that power? What does that mean for me? Does that mean that I step aside and I don't do the work that I do? Does that mean that I need to think about critically about how I've been engaging with others? I need to work in how I change that engagement. Does that mean that I work towards dismantling the institution that I work within? What does that mean, right? So starting with that individual reflection, and then moving on to this collective of institutions asking themselves, what is our purpose of existing? What work are we doing? And are we doing more harm than good? And so if we have, and then having this radical imagination of what the future can be. And I say radical imagination, that's something that I am still working on. So I can't even tell you, really, if you ask me what a decolonized global health looks like, global health field, or a decolonized institution looks like, or a decolonized Duke looks like, I can't even give you really an answer, because I'm still working on that process of that internal reflection and that radical imagination. But I think it can be very possible to do so when we have that individual work and that collective work of saying that we're having this very radical shift in how we work with funding. We're having this very radical shift of how we set agendas for research and policy, and having this radical shift of how leadership, how these organizations and institutions are being led. And so in order to really do that, we have to do that in order to get to decolonize. And I think, I said it's a yes and no. I think it's possible when we all work this as a collective and are willing to do the actual serious and radical work. Then I say no, because honestly, I can say that from the last 2 years of being in this, year and a half of being in this pandemic, I've seen a lot of examples of ways that people want to protect that, hold on to whatever power they have. And I've seen how these systems will keep protecting those who have power, and these systems and institutions will want to protect their own power and their own privilege. And so I hate to be a Debbie Downer, so I'm going to try to leave with some other approaches, right? So I mentioned earlier that decolonizing means dismantle or destroy. And also know this is not something that's going to happen overnight. It's something that's going to take actual continual effort, which is happening with critical individual reflection and critical collective reflection. But there are anti-colonial approaches that we can take. And I make a distinction between anti-colonial and decolonize because I think anti-colonial sometimes can be what I mentioned as those smaller steps that we're taking towards a more decolonized world. So there's things that institutions could do, anti-colonial approaches that they can do, actions that they can take to at least start working towards decolonizing. Because I recognize that I may not, as much as I would love to be able to, close my eyes and make a wish and for it to happen, I recognize that it's really hard to do that because colonialism is embedded in everything that we do and how we live and breathe and move through this world. And so, and these institutions have been built on it, and it's been so cemented that it's not going to be as easy as us saying, we're going to, move on, set a resolution and it's going to work the next day. It takes hard continual work, but institutions can take anti-colonial approaches to education and research. And so these 3 shifts that I'm listing here on the slide actually came from a paper my colleagues and I from the Duke Decolonizing Global Health Working Group, a paper that we published last year, where we proposed these 3 shifts that can happen in global health institutions. So thinking about especially academic institutions and in the context of education and research, there are 3 shifts that institutions can take. And again, these are, I call them anti-colonial approaches, because I think decolonizing would really take it a step further, like I said, where some of these institutions would no longer exist. But the first shift is this paradigm shift. So we have to start grounding global health education and research in a health justice framework. And what I mean by that is when we're teaching the new global health scholars, when we're teaching global health students, future researchers and practitioners, we have to start with this health justice framework. And that starts with number 1, recognizing that all the health inequities that we purport to address in our field don't happen in a vacuum. There is a very historical context that there are reasons that we're seeing them. So for example, in COVID-19, as we've seen these numbers and even really pre-vaccines being available, we were seeing that a lot of American Indigenous people were being affected and that they had the highest rates of infection, as well as the highest rates of hospitalization and death compared to white non-Hispanic people in the US. And so we're looking at these numbers, and and a health justice framework says, I'm not going to just assume that there's just, it just happens that it's American Indigenous people that are having these poor health outcomes as a result of getting COVID. It's realizing, well, the reason for that is because of colonialism. It is because they have been forced into these reservations where they've had their land stolen, where they don't have enough healthcare facilities. They don't have equitable access to healthcare. And even if they were to seek healthcare, they're most likely going to be faced with discrimination as they're seeking healthcare. And so this health justice framework grounds how we're approaching these inequities. So if I wouldn't do this, because again, part of that critical reflection is realizing that my job is not to go and fix something happening in another community. But if I was to work with someone who would let's address these health inequities that we're seeing in COVID-19, we would start by thinking about that historical context of how we're seeing these health outcomes play out in this pandemic. The next thing is a leadership shift. So I mentioned earlier when I was talking about decolonization is not a metaphor for representation. And that is because representation is not inclusion. And I say that to again go back to saying, also related to DEI, it is important for institutions, yes, to have more diversity. It is important for people, someone that looks like me, for me to feel like I'm being represented. But I also recognize that me seeing someone that looks like me does not mean that I'm being included. That does not mean that that institution or that organization or that school actually performs or sets forth policies or practice that aligns with protecting and actually including me. That does not mean that even if I was to be the person that was invited to be on the board of directors or invited to be on a staff as a staff member, it doesn't mean that when I'm sitting at the table and we're making these decisions that people are listening to me. Because what usually happens is that is very much a tokenism of to say, look at us, we're doing really well. Look at us, we have these people and we're checking off these boxes, but ultimately we didn't actually create an environment where they feel that they're included, where they feel that their opinion and their contribution is valued in the same way as their white male counterparts. And so that leadership shift comes from, yes, representation and having more diversity and having people from low and middle income countries or people from former colonized communities or more women or people from, different sexual orientation, different genders in leadership positions, but also creating a system or creating an environment where they can actually flourish and thrive in that. And the next thing is a knowledge shift. And I think this is one of the biggest things that global health institutions and academic institutions can do. We have to start promoting multilateral flow of knowledge, and we have to start promoting othered ways of knowing. One thing that is very still present and why colonialism is still very much important and embedded in global health field is that we've really maintained this cycle of saying that we're maintaining the supremacy of what is Western, and really by Western I mean white knowledge, that we've maintained the system saying it only matters or it's only important if we're hearing this reported from, whether it's Canada or the US or Western Europe or Australia. Or it's only important, or this knowledge or this information is only valid if it's being affirmed by people from these countries. And that's also been in the same way with education, thinking about what knowledge are we actually sharing with each other and what knowledge are we consuming for ourselves? Are we embracing other ways of not knowing? Are we embracing other ways of interacting with each other and interacting with the earth and interacting with other beings on this planet? And so that knowledge shift is really important because we have to promote this multilateral flow of knowledge. That could be something as simple as changing your curriculum so that you're including more readings of people from, other communities, and encouraging students and encouraging young practitioners or researchers, and even current researchers and practitioners to really embrace that other way of knowledge and really stop focusing on maintaining the supremacy of what is, Western or white knowledge. That could mean that we don't always rely on what's been published. And I say that with a caveat, right? Because recognizing that often, as we talked earlier, because of these oppressive systems and this constant subjugation, oftentimes who gets published, right? And if we're only looking at what's been published, and we're not thinking about who gets published and whose knowledge gets given priority or gets to be set on the same level, then we are never going to hear about other work. We're never going to hear about other ways of knowing. And so this knowledge shift, I think, is something that's probably one of the biggest things that academic institutions can do. And really that can start with, again, engaging with other material, engaging with other what's been written out there, having conversations with people that you were previously not communicating with. Encouraging students not to just focus on what's being taught in the classroom and really seeking out other ways of knowing. If they're going to do, their field work in another community that's not their own and that they've never been in, are they taking the time to really actually engage with the ways of knowing from that community? And that could mean that the ways of knowing in that community is not about what's being published in academic journals. And that could mean that other ways of knowing is not about what's being written in books or what's being shown in media. It could be that the ways of knowing are sitting around in a community gathering or in a familial gathering and talking, and that knowledge is being shared that way. And so embracing that other way of knowing, and also recognizing that they go hand in hand. And so not to say that I'm rejecting what is Western or white knowledge, no, but I'm saying that all of these can work together, and we can have this multilateral flow of knowledge where it's not just knowledge coming from the US, Canada, and Western Europe, and it's flowing to these other communities, but that knowledge from those other communities can also come the other way. And we can have this multilateral flow of knowledge where we're all embracing other ways of knowing. So as I'm wrapping this up, I want to go back and really emphasize that, again, when I talk about decolonizing, I'm very much, talking about this dismantling, and leaving you with this reflection of really, I encourage you to ask yourself, is it possible to decolonize institutions? Is it possible to decolonize your institution? And asking yourself, do you think that people that you are working with or in this movement having these conversations, are they really invested in that radical change of giving up their power, and that radical change of how funding works, that radical change in how knowledge is being shared and created, that radical change of who gets to set the agenda? And if that commitment is not there, then really we're not interested in decolonizing. We're interested in trying to make our, moving ourselves to innocence so we can feel better, because we recognize that something is wrong, but we're not comfortable with giving up our power and privilege to really fix it and address it. But also, while we're doing this critical reflection, there are still approaches that institutions can take, and there's still approaches that we individuals can take. So I will leave it there, just so I leave enough time for us to have a discussion and answer any questions that anyone has. This last slide, just thank you once again for having me. I put in here my email. I'm always happy to talk more. I'm also on Twitter, where we can have more conversations about decolonizing and what that really means, both for us as individuals in global health or in academia, and what that means for institutions that we're working in. Thank you.
Thank you so much, Laura. That was really a fascinating talk, and so helpful to all of us to as we're learning about how we can support and move forward. So really fascinating. I took lots of notes just for myself, and I do hope that you're willing to share some of your the readings that you mentioned, because I think that would be of great interest. So I think we're going to move now into questions. So if folks have questions, I believe that you can either raise your hand or write them in the chat section. Okay, so we have Sam Yee. Would you like to go ahead?
Hi, so yes, my name is Sam. I just want to say that talk was so great. Like every single point is just hitting it home for me. And I related like your experiences a lot to my own as well, because when I was reading your bio, I saw that you did an undergrad in biology. I'm in biomedical sciences at U Ottawa. That's my major. I'm also minoring in Indigenous studies. And there's like a lot of areas where I'm finding there's almost like this dissonance between like Western paradigms used in scientific research and the research methods that I'm learning in my Indigenous studies courses. So I was actually thinking of the same questions that you were asking at the end of your presentation, and I just wanted to kind of share some of my own reflections on that, because if you're, I'm not sure how much you know about the University of Ottawa, but it was actually founded by the Oblates, who were heavily involved in the residential school system in Canada. And I've worked like as a student with the Students' Union at U Ottawa. And one of the things that is kind of part of our list of positions is to decolonize the University of Ottawa. And when I'm thinking of, everything that you said in your presentation, I wonder whether, if you do replace it with like the word dismantle University of Ottawa, like, is that possible? Is that something we can really do, especially when it has this history? And you mentioned as well that like the university that you're at, Duke, has this history as well. And same thing with U Ottawa and many other institutions. They were literally founded on like by these structures and with these ideas in mind of elimination. And so it's really hard to just kind of, again, dismantle that. And I was also thinking like ideas of, the distribution of power and wealth as well. Like we have people higher up in our admin who have like over $400,000 a year salaries, while we have students who are struggling to pay for their tuition. And so I was thinking of, the imbalances of power there as well. And I'll just kind of end off my comments because I've just had a lot on my mind with this presentation. But for my honors thesis project, I have the privilege of being able to work with Dr. Manisha Kulkarni, actually. And our project involves working with partners in Benin in Africa. And so I've kind of had this thing constantly on my mind while working on this project. It's like, am I being involved in perpetuating a lot of these colonial notions of global health by working on a project like this and having my own self benefit by being able to have the privilege of writing an honors thesis about this type of work. But I'm really, really happy that I found like Manisha's lab, because I think there's an emphasis there on this isn't like helping people necessarily like do things. It's partnering with people who have identified health needs in their communities and kind of having that knowledge sharing on like they're asking for, you know, other researchers to help them solve these issues, and we are providing that help where we can. So I've been trying to navigate a lot of these issues that you talked about, and I just wanted to say, you know, thank you very much for this presentation, and thanks for listening to my comments as well.
Yes, thank you so much for sharing that, Sam. And I think one thing I will say that I want to remind everyone, especially, you know, I'm a young professional, I'm pretty much like starting out professionally in this field, right, is really having a lot of grace for yourself. Because as much as I know I give these talks, I'm talking about dismantling and destroying, but then there's also this, you know, we have to also live with this like realistic and logic of, we live in a world where you have to have higher education to really advance in it. And that could mean whether or not you have a roof over your head and you have food on the table, right? And so some of us have to work in these systems, and some of us have to keep working with that, even though we know that there's in some ways, right, like despite our, you know, with our best intentions, it might be causing harm, or it probably is causing harm. So I think I want to also, like, I know I gave this talk and I'm mentioning all the ways that we are, you know, the system is wrong, right? And the system is wrong, but also having grace and recognizing that, yeah, some of us, like, we have to, you know, I got my master's degree, I had to write a thesis and I chose to write my thesis. I'm originally from Tanzania and I chose to do my field work in Tanzania. And honestly with that, I had a similar conflict that you've had, Sam, where I was asking myself, and I'm like, first I was like, well, I'm going home. And then I was like, again, that positionality of, yeah, but you get to leave after 10 weeks. You know, you get to leave and you've worked with, you know, whether it's working with my team that was, you know, collaborators on the ground, and we're working and sharing knowledge with each other, but then I get to leave and then I get to write about it. I get to have a master's degree and I get to write my thesis and I get to go on and do other things. And so that is something that's always in my mind, but I also do want to encourage, especially young folks, as we're having these conversations, to have grace for yourself, because we are, you know, sometimes we unfortunately have no option but to work in the system, because it's not as simple as us just, you know, snapping our fingers and everything is much better and we can work without having that guilt. And so that grace is really important. And also just commending you and really, again, encouraging others. Again, that critical reflection piece is where it really comes in, and constantly asking yourself those questions. It's exhausting. I get tired of myself asking these questions, but constantly checking in of how we're moving through our, you know, collaborative partnerships, how we're moving through our institutions, and how can we, at least if we can't decolonize and dismantle, how can we at least be anti-colonial and more equitable and more just. So just to say, I hear you, Sam, I am with you with that, but also just encouraging, you know, having a lot of grace, because we are, like I said, I am also working within Duke University. I have to pay the bills, right? And so you have to have that grace for yourself as well, because again, you're also having that critical reflection and really thinking of how can we actually make this more just and better.
Thanks so much, Laura. That was a very thoughtful response. And I think Sam has highlighted an issue that we all are struggling with as researchers. So I have a question here from Amira Khan. Laura, she says that was amazing, which I think we could all second. Her question is, have you seen any academic institutions in the West or in white countries be successful in decolonizing or take concrete steps towards it?
I have to really ask myself that. I don't think anyone has been successful in decolonizing. I will say that, at least in my opinion. And if there's just one that I'm not thinking about, my apologies. I think I've seen a movement, especially in the last 2 years, of institutions who are trying to take concrete steps towards decolonizing, or at the very least taking concrete steps and concrete anti-colonial approaches. I have seen that, and I think I have seen a lot of institutions very much well-intentioned, right? It's not for me to really judge and say that it's performative or not. I can only speak for something that I'm physically interacting with or interacting with personally. I think I have seen institutions who are at very least, I think right now a lot of institutions, a lot of individuals are at very least in the stage of we're having the conversation and with that critical reflection phase. And I have seen institutions who've put forth initiatives to at least address it. Can I say that it's, would I consider it a concrete step? I think that's a conversation for another day, but I will say I have seen at least intention towards anti-colonial approaches and intention towards decolonizing. And that is something that I've seen with a lot of institutions across, in many places. But again, there have been some where I've looked and I've, when I'm reading about it or I'm interacting and I'm really asking, really, or is this kind of more performative because we feel like we have to engage with these conversations because it's it's like in vogue is what everyone is talking about, but I have seen some institutions who are at least taking steps towards it.
Great. Our next question comes from Sharika Sarasija. Laura, thank you for the wonderful talk. In your opinion, how do we decolonize global health and academia while retaining descendants of colonizers as our allies? Essentially, how do we proceed without isolating others for their privilege?
Wow, that is a really good question. That is a good and really hard question. Wow. I think I will start by saying this. When I think of decolonizing, of course, we have to address white supremacy in it. And recognizing that white supremacy does not necessarily mean that you are dismantling white people. I think having kind of that, right, or dismantling, because descendants of colonizers, they didn't choose to be their descendants. I will extend that grace and say they are not choosing to be those descendants, but people do choose you don't choose who your ancestors were. Right. In some ways, I think we don't necessarily always get a choice of what our ancestors did before us and what harm they caused, but we ourselves can make an effort that in our lifetime that we do better. We're not, I don't want to say fix it, but we're at least kind of paying that karmic debt and we're cleansing that karmic debt and saying that we're not going to perpetuate what happened previously. So again, rejecting and denouncing white supremacy does not mean denouncing white people or descendants of colonizers. And really the other thing too is decolonizing is also about building a better ways of how we're interacting with each other. And I knew I should have written it down, but there is this really wonderful tweet by an Indigenous scholar who talked about, decolonizing is also about how we're interacting with each other and building better relationships with each other, and building better relationships with the land, and building better relationships with, other beings on this planet. And so it's not really right. We're rejecting capitalism, rejecting, at least I'll say that, I'm rejecting capitalism and patriarchy and white supremacy and sexism and anti-Blackness in my effort to decolonize. I'm rejecting those systems, but I'm not rejecting the people who don't get to choose if they have that privilege, but they do get to choose whether or not they exercise that privilege in order to oppress others. I don't know if that's answering your question, Sharika, but I think it's, we don't need to isolate others because as I mentioned earlier, in order to really decolonize global health institutions, it has to be a collective effort and everyone has a role to play in it. And there are people who have more privilege who can use that privilege in order to make actual effort and radical work, radical change. And so I don't think that means that we have to, isolate others or say that they no longer have a place in our community, but it's about building a better relationship and how we're interacting with each other. I'll stop there and see if that answered your question, or if you want to have if you have a follow-up question or a comment to that.
I guess I would ask, how do we include them more? Like, without putting the pressure of, say, white guilt on them.
Yeah. I think for me, I can speak personally. I think for me, one thing is I don't take it on myself to keep someone from not, having white guilt, right? And I know that's not what you were saying, but I make that clear of like, if I'm calling out a system that you're participating in, right? And again, and I include myself, right? When I'm calling myself out, granted, I'm responsible for my feelings and my reaction to that. I'm not responsible for how other people react to that being called out. But they can, I think, especially people with privilege and power can absolutely, there is a role for them to play. So going back to that example of thinking of, this very wealthy musician who's getting crowdfunded to get a Rolls Royce, right? I just kept thinking of, if all the people that donated all that money just gave it to another person, right, where we have to live this mutual aid, who gave it to someone who actually needs it, like that's a role that someone with privilege is playing. So in the same way, if you're in in a space where someone's benefiting from white supremacy or that white privilege, if they are witnessing how this system is being played, if they're witnessing, for example, say we're in a room and I am trying to make my voice heard, and they're seeing that I'm being discounted, they're seeing that I'm being dismissed, or they're seeing how policies are being enacted, or they're seeing how knowledge is being talked about, or they're seeing how Black and Brown people and Indigenous people are being talked about, using that voice because you have a certain level of protection to say, hey, that's not cool. Like, this is not how we should be moving. This is how we should not, this is not how we want to interact with other people. And so there's this role of, they can have this play of using their privilege and their power. And at some point, all of us have some level of privilege or power, depending on where we are in our positionality, right? And using that to help those who have less power than you. And recognizing who's more marginalized that I'm interacting with, and how can I use whatever position of power that I have to speak for, let me not say speak for them, excuse me for that, but to really help them have more, sovereignty, to have them have more power. So it's really about, again, like there's a role that we all play, because we don't have to isolate each other, because it has to be a collective effort where everyone is invested and really committed to that radical change. Yeah.
Thank you so much, Laura. That was so insightful.
Thanks, Laura. I think you did a phenomenal job responding to that, and a lot of important food for thought. We have a next question from Manisha.
Hi, Laura. Thanks so much for your amazing talk. It's so thought-provoking and wise. And, I love the talk about radical change. And I guess I have more of a comment than a question in terms of, I think as individuals working in these institutions, this critical reflection is so important about how we're benefiting from our institutions in terms of the power and privilege, but then the power that we have to be change makers as individuals who are working in a global health field, who are working with partners, trying to have equitable collaborations with folks and communities that we've been invited to work in and with. And I think one of the 3 steps, I know these are anti-colonial actions and not the transformative radical change that we need, but I think this, starting with this mutual flow of knowledge, this multilateral flow of knowledge, I think is so critical and important, and something that we really need to highlight in all of our initiatives, whether it's research, whether it's education, whether it's clinical practice. And I just wonder, do you have thoughts about how best to go about this? Should this be done way before we even have a concept of a project, or there's a call for funding or something like this? Where does this need to start, and how should we best go about this for people that are working in institutions that are trying to improve global health and health equity?
Yeah, that's a really good question. Honestly, I'm not even sure that I have the answer of where we should start. Or rather, I'm not sure if it's the answer that I'm most confident of in this moment. I will say for sure, it definitely needs to be before we're writing the protocol and before we're coming up with this concept. Before we're really deciding what. So I think that critical reflection and taking a moment to ask before we even come up with an idea, right, is asking ourselves, first of all, has this idea already been done and we just don't know about it because it's not what's been, given priority or prominence. And again, what our existing flows of knowledge or ways of knowing is one. And especially, again, something for me that I know I wish I'd done differently, I can speak for personally with doing my field work, is I wish before I even wrote my thesis proposal, I actually interacted more with the collaborators I was going to work with on the ground and asked, are you actually, is what I'm interested in studying, is that actually what's going to be useful for you? Is that something that you're interested in? What would you want me as an outsider, right? Even though I'm going back home, but I'm an outsider. What would that look like for me as an outsider coming into your community for 10 weeks and conducting my research for my thesis and then leaving? And then going with that and working collaboratively so that we're more equitable and more just. And that's really honestly the best answer I can think of. I think I'll have to keep reflecting on it, but it definitely has to be before we're even writing the protocol. And if I could go back, I would have done it before I'm even writing my proposal. And then going to my, Tanzanian PI and saying, this is what I want to do, right? And I didn't even ask her before I even wrote it what I want to do. And then that way she really is stuck with editing my idea versus we work together to come up with an idea that is actually going to work for her and for the community that I'm going to work in. I think that's really the best answer I can give right now. But I honestly, I don't know, truthfully.
Yeah, no, thanks so much. I mean, that's really concrete, and I think it really hits the nail on the head. Like, we need to change how we do idea making, right? Yeah, absolutely. Thanks.
Thanks. Well, I think we're probably at the end of our hour, but Laura, as all of the commenters have said, this has been a really a fabulous talk today, and this is an important dialogue for us to be having here at the University of Ottawa, an important dialogue for every researcher who does work in what was known as global health, and hopefully we'll have a new a radically new approach in future years. So thank you so much for coming and inciting these discussions and giving us some really important things to discuss and to think about as we move forward on our own on our journey towards decolonizing our programs.
Yes, and thank you once again for having me. Thank you everyone for those really thought-provoking questions that I will be reflecting on after this presentation.
Great. So, well, and thank you for taking the time. We recognize that you have lots to do other than educating the world about decolonizing global health, but we really appreciate you taking the time to share your thoughts. So I hope you have a wonderful rest of the afternoon. I hope to all of the participants who were able to join today, thank you very much for joining. And I wish you all a wonderful end of your day.
Okay.